Hey guys, it's Kelby Hightower with Medicare Monday for Seniors. Hope you guys are doing well. Medicare Monday for Seniors is all about providing you bite-sized information to make your life easy by making Medicare simple. We'd invite you guys to be able to like and share us on Facebook, and also check out our YouTube channel. That's where you're going to find deep dives into all the content that we share here on Medicare Monday for Seniors. A lot of times people are looking for additional information so they can do their own self-studying to help them, either A, trust us enough to call us, or B, they just like to deep dive into things themselves and learn the additional information that they're trying to find. And our YouTube channel would be a great resource to be able to go to. We also invite you guys to watch, listen, and then give us a call. You're going to have answers, and you're going to have a licensed professional enroll you into a plan. Unless you try to do it yourself, and that can be a disaster. We would encourage you guys, once you get to a place of comfort, to be able to give us a call and allow us to be able to guide you through. We can do that over the phone, we can do that in person, whatever meets your needs. We have brokers in about 10 states, and we're located here in Clarksville, which is right outside of Nashville. So a lot of our clients, we meet face to face here in this area, or we can do it over the phone now that we live in the world of COVID and all the different things that are going on with our seniors to keep them at a lower risk. So today I'm going to couple what I talked about last week. We talked about hospital indemnities and how you can pick up a hospital indemnity plan to cover the copay cost for your Medicare Advantage plans. Medicare Advantage plans typically have a copay per day, day 1 through 5 or 1 through 6 or 1 through 7 in hospitalization. So a lot of times we come along beside that and we do a hospital indemnity plan. And part of the hospital indemnity plans with the carriers we deal with typically will allow you to add a cancer rider. For a few dollars more a month, you can add a cancer rider. Now, what does that do for the person that's on original Medicare, I guess, or if they're on a Medicare Advantage plan? Well, the Medicare Advantage plans have an out-of-pocket maximum. A lot of times they're $6,700 or less, or they may be a little bit more, a little bit less. There's this large dollar amount that they may be exposed to. Well, for any of you guys that have ever had a family member or friend or yourself have gone through cancer, chemotherapy can be, with Medicare beneficiaries, most chemotherapy or injectable drugs fall under Part B chemotherapy drugs. Well, on Medicare Advantage plans, the Part B services for those are billed at 20%. So if you're getting, if you're going in and get a treatment done and it's $2,000, 20% of that is $400. If you go in, most treatments are $4,000 or so, 20% of that is $800. Well, $800 into that $6,700 out-of-pocket maximum, it doesn't take a lot of those at $800 to reach your out-of-pocket maximum. And at $800, you all of a sudden start getting these bills, and you're like, what am I going to do with the bills? Typically, chemo is going to last for less than a year. So what we would encourage somebody to do is insure that liability or that risk, really that gap in coverage for that out-of-pocket maximum by adding a cancer rider. So if you're diagnosed, now the percentage is about 50% of the people are going to be diagnosed over their lifetime with some form of cancer. So in that diagnosis, the policy can actually pay you a lump sum amount of money. We usually do a lifetime benefit for our folks that we put on cancer riders, which basically means the money builds back up and it can pay you out throughout the lifetime. You don't just use the policy once and drop it and it falls off. You actually, if you have a reoccurrence several years later, that policy can pay back out. And the policies are all designed a little bit different, so we guide you through what's going to meet your needs best. But that cancer rider actually will pay a lump sum amount of money. So we normally, if the out-of-pocket maximum on a Medicare Advantage plan is $6,700, we usually do about $10,000. That pays to that Medicare beneficiary. They can pay their chemo test or treatments. They can pay for testing. They can pay for gas and the travel expenses and stuff. And sometimes they have a little money left over. Or, sadly to say, we've had people that are diagnosed terminally ill with cancer, and they get a $10,000 check, or they can choose to get less than that, but $10,000 check, and they say, you know what, I don't have any life insurance. And by how the law really is written, medical debt cannot pass on to beneficiaries. So if your children are handling your estate, they're not going to get the medical debt. They send it a death certificate and they have to write it off, and it's a loss. So what I would encourage people to do is, if you don't have any life insurance and you haven't taken anything off of your bucket list and you have a trip planned to maybe go to whatever, Hawaii, take a trip, take some of that money, and then take the additional money and pay it towards your medical cost. If you're in a terminal situation, sometimes just living life for the last few months is more important than worrying about incurring issues of paying those bills. And a lot of you guys are like me. I would want to pay my bills and be able to take the trip, and sometimes you've planned financially and you can do both and it's not that big of a deal. But the cancer riders are great to be able to add on. You can actually do a cancer policy, so you don't even have to have the hospital indemnity. You can just do a straight cancer policy that picks up and covers the cost the same way. So for you guys that are on Medicare Advantage plans, if you don't have hospital indemnity with a cancer rider, or you don't want the hospital plan and you just want the cancer policy, we'd love to be able to walk you through the options. Give us a call or go into more of a deep dive onto our YouTube channel to learn about some of those products and services and things, and then reach out to us. Guys, until next week, have a great week. We're going to be talking about other ancillary products like dental, hearing, and vision over the next 2 weeks with you as well. Talk to you soon. Thanks.